Donna. I'm your doctor of physical therapy student today. I'm just going to wash my hands real quick, okay? Alright, I'm just going to check that wristband right on your wrist to make sure that you are who you are. I understand you got some meds earlier. Can we still not talk? No? Okay. Nodding no and yes is great. I'm going to move this out of our way. Okay, so today we're going to try and get you out of bed. We understand you had hip surgery earlier today. Can you give me a nod for yes? Okay, great. First thing we're gonna do is we're gonna teach you how to sit up, okay? Are we feeling okay? Let's put a pulse ox on you just so we can get this all checked. I'm just gonna leave this on you while we get up and start moving, okay? I'm also gonna teach you some bed exercises today, so I'm gonna take this off and I'm gonna show you some things that you can be doing while you're in bed, laying here, and kind of help keep blood flow to those lower limbs, okay? Alright, so I'm going to leave this elevated for now just so you can know what it feels like to do this while it's elevated. But the exercise I want to teach you are just simple ankle pumps. And the reason we want to do ankle pumps, especially while you're in bed for a long period of time, is to encourage blood to return from your limb back up to your heart, like it normally would do. But sometimes when you've had a surgery and are in bed for an experienced time, that gets hard for the body to do. So what I want you to do is I just want you to pump that foot like you're stepping on a gas pedal. Can you do that for me? And come all the way down, all the way up, perfect, yep, and all the way back down, and all the way back up, great. And so what I want you to feel is a good contraction here in your calf as you do that, and I want you to be doing these pretty frequently throughout the day, maybe 33 times a day, just as you're laying here, okay? Okay, great, well now that we've taught you how to do that, I'm going to remove this pillow from you. Okay. So as we sit up, I'm going to make sure that we kind of keep everything out of the way here. I'm going to teach you how to use a walker today. Have you ever used a walker before? Okay, great. Well, we're going to learn how to use one today. Okay, so left limb involved, right? This is the one you had surgery on this morning. Okay, so what we're going to do is we're going to kind of slide you this way off the bed, but what I want you to not do is get that hip above 90 degrees of flexion. So in order to prevent you from doing that, I'm going to help you with the movement, but I also want you to try and use your upper body as much as you can. Does that all make sense? Okay. So first thing I want you to do is kind of diagonal your body this way, so don't move your upper or your lower body, but kind of use your elbows and prop your upper body in a diagonal. Okay, perfect. Okay, so can you move this leg okay? Perfect, okay. So I'm gonna assist you in sliding this leg over the bed. As we slide this leg, I want you to follow with your other leg, and then I'm also going to assist your upper body. So go ahead and use your upper body as much as you can. We're gonna slide this way. I'm gonna move this for you, and then go ahead and help me with that other leg, and we're gonna move this way. Okay, perfect. You go ahead and relax that limb. Okay, now as we're here, I'm gonna go ahead and take your blood pressure. We feeling okay? Lightheaded at all after standing or sitting up? Okay. You can just rest your arm right on there. And borrow this arm. Does that feel comfortable for you? Okay. So first thing I'm gonna do is to palpate right here. I'm gonna pump it up and kind of feel when this pulse begins to kind of fade, and that's how we know how much to pump it up, okay? So feeling okay? Let me see your other hand. Okay, pulse ox is normal. Heart rate is looking normal.
Start from entering the room and finishing and leaving the room. So you gotta come through that door, gotta knock, and then after you do your gate training, whatever, get them back in 2 times and walk out. You want it in 4K?
Yeah, I want that cinema. Make it look nice, okay?
Holy cow.
Oh,
Yeah, you can count
it's
that.
over there.
Oh, that's one thing.
128/92.
Oh,
Still feeling okay?
yeah.
Alright, so we're gonna go ahead and get this stuff out of your way. I'm gonna put a gait belt on you. Have you had one of these on before? Okay, so gait belt is just kind of a precautionary. It allows me to be able to support you while we're up and walking around, okay? So I'm gonna reach around you.
Before 4K at 30th, or you want 60?
Whatever you think is best.
So this should be nice and snug, okay? But you just let me know if it's uncomfortable. Is that okay? Okay. Alright. So what we're gonna do here, I'm gonna put this here in front of you just for now. And then we're gonna use it to stand up. So doctor's orders is that we can put weight on this limb, but we're just going to kind of avoid overly moving it in unsafe positions, okay? So we can put weight on it, but again, not moving it over 90 degrees here or crossing the middle of your body, okay? Alright, so I'm gonna place this here, and so what I want you to do is you're gonna take your, you're gonna sit up for me. I'm gonna take off your restraint. Alright, so what we're gonna do is let's scoot to the edge of the bed without putting too much weight in there. There you go. Okay. So what I want you to do is we're going to push off, so take this hand here and place it on the walker. I'm gonna stand here on your uninvolved or involved side. and you're going to use this arm to kind of push you up and then use this arm to push you off the bed as we stand up, and I'm here to assist you. I'm gonna try and encourage you to do it as much as on your own, but let me know if you need help. Okay? All right, let's go ahead and try and sit up. Okay, perfect. Did you have any discomfort or pain with that? Okay, perfect. So now that we have the walker, let's go ahead and adjust it a little for you so it's a little bit more of a optimal height for you. Can you stand up straight for me? Is that a comfortable height for you, Sally? Okay. Okay. So I'm gonna make sure to have So I'm gonna have a hand on your IV as we're kind of walking. Let me just make sure I clear Okay, so how we use the walker is we're gonna walk this way, and what you're gonna do is you're going to move the walker first, and then we're gonna go your involved side first, and followed by your non-involved side. Okay? Yep. How's this feeling, Sally? Good? Okay, and then as we turn, we're gonna make sure that we tilt the walker first, and kind of follow as a small maneuver. Perfect. Okay. And then we're gonna walk back and kind of lay back in bed just to show you how to walk around. So go ahead and stop with the walker. We're gonna start to try to turn around. So coming back up, as close to the chair as you can, or as close to the bed. And then same thing as when we stood up. I want you to, one hand on the walker, one hand on the bed, kind of reach back. Feel for that bed. Okay, good. Okay, how does that feel? Good. Take this. We're gonna get you back in bed. Okay, so kind of same thing here is we're going to slowly lift the leg up this way. I'm gonna help you with this leg. So using your upper body, go ahead and scoot back just a bit. Okay, good. I'm gonna help you with this leg. Go ahead and slide that other leg over. We're gonna lay it back down nicely. Okay. And I'm just gonna go ahead and put this back on for you, okay, Sally? Sally, just a bit, just to put your pillow underneath. Okay. Are you feeling comfortable? Okay. Alright, I'm gonna put this here back for you. First. Alright, I'm gonna leave this walker in here for you just in case the nurses want to come back and get you up later. Let's put this back on you. Okay. Okay, are you feeling okay? Are you comfortable? Okay, well, it was really great to meet you, Sally. I'll be back today as we're gonna be doing exercises twice a day, okay? If you have